Doaba Radio, Doaba Radio, Doaba Radio, Doaba Radio,
Doaba Radio.
Today we are going to discuss lesson 4th of 12th class, and the lesson is reproductive health. Myself, Prabhjit Kaur, lecturer bio at GGS Maur Mandi, Bathinda. Now the topics of today's discussion, they will be reproductive health, population explosion, birth control, then medical termination of pregnancy, sexually transmitted diseases and infertility. So we will discuss these topics one by one. Coming to the first topic as reproductive health. Now we will discuss the problems and strategies, but before discussing the problems and strategies, you should know what our reproductive health is. It means reproductive health means a total well-being in all aspects of reproduction, means physical, emotional, behavior and social. Then the problems which are related to the reproductive health, these are: first is there is little knowledge of the personal hygiene and hygiene of the reproductive organs, and this causes sexually transmitted diseases. Then second problem is early marriages in India. They lead to high maternal and infant mortality rates. Then third is due to lack of awareness. There is rapid increase in population size. Then people encourage beliefs in the myths and misconceptions about the sex-related issues. Then the strategies are: first is the family planning programs. They were initiated as early as 1951. Then second is the reproductive and child health care RCH programs are launched in 1997 for creating awareness among the people about the various reproduction related aspects. And then second, providing facilities and support for building up reproductive healthy society. The third is, with the help of audio-visual aids and print media, both government and non-government agencies are engaged in creating awareness among people about reproduction-related aspects. Then encouraging sex education in the schools to give the right information to the young minds and to save them from myths and misconceptions about the sex-related aspects. Then next is proper information about the reproductive organs, adolescence, related changes, safe and hygienic sexual practices, and sexually transmitted diseases. These should be given. Then educating people about available birth control options, care for the pregnant mothers, prenatal, postnatal care of the mother and child, importance of breastfeeding, equal opportunity for male and female child, postnatal care, then awareness of problems due to uncontrolled population growth, then statutory ban on amniocentesis, a fetal sex determination test which is based on the chromosome pattern in the cells found in the amniotic fluid surrounding the developing embryo for the sex determination to legally check increasing female feticide. So there is ban to check the sex determination, or there is statutory ban on the amniocentesis technique. Now the second topic that we are going to discuss is the population explosion. But before discussing, you should know what do you mean by population explosion. It means the tremendous increase in size and growth rate of population, that is known to be as population explosion. And the world population was about 2 billion in 1900 and was 6 billion in 2000. So population of India at the time of independence was about 350 million and it crossed 1 billion in May 2000. Now reasons, what are the reasons for the high population growth? Here are the reasons. First is the rapid decline in the death rate. Second is the decline in the maternal mortality rate, that is known to be as MMR. Then third is the decline in the infant mortality rate, IMR. Then fourth is the increase in number of people in the reproductive age. So according to 2001 census report, the population growth rate was about 1.7%, that is 17 per 1000 per year in India, and a rate at which our population could double in 33 years. So what are the steps to curb this population growth? These are, first is the raising marriageable age of girls to 18 years and that of boys is to 21 years. Second is incentives should be given to couples with small family. Now the next topic that we are going to discuss is the birth control. The most important step to control population growth is to motivate smaller families by using various contraceptive methods. And an ideal contraceptive, it should be user-friendly, easily available, effective and reversible, with no least side effects, non-interfering with the sexual drive or desire and or the sexual act of user. Then methods of birth control. The contraceptive methods, they are divided in the different categories. First is the natural and traditional methods. And second is barrier methods. Third is intrauterine devices, IUDs. Then oral contraceptives. Fifth is injectable and implants. Then sixth is the surgical methods. So we'll discuss these methods in detail one by one. First is natural methods. These are the natural methods that work on the principle of avoiding the meeting of ovum and sperm. And here first part of it is a periodic abstinence is a method in which a couple avoids or abstains from coitus from day 10 to 17th of the menstrual cycle when ovulation is expected to occur. Then coitus interruptus or withdrawal method. Then lactation amenorrhea. It is based on the principle that during the period of lactation after parturition, ovulation doesn't occur. Then second is the barrier method. This was natural method. Now second is the barrier methods. These methods, they prevent the contact of sperm and ovum with the help of barriers. And such methods are available for both male and females. Here, first is the condoms. They are barriers made of thin rubber or latex sheet used to cover the penis in the male or vagina and cervix in the females. It prevents the deposition of ejaculated semen into the vagina of the female. Then B is the diaphragms, cervical caps and wards. These are the barriers made of rubber that are inserted into female reproductive tract to cover the cervix during coitus and they prevent the entry of sperms through cervix. C is the spermicidal creams, jellies and foams. They are used along with these barriers to increase their contraceptive efficiency. Then third method is the intrauterine devices, IUDs. These devices are inserted by doctors in the uterus through vagina and these are three types. First is a non-medicated IUDs, then copper-releasing IUDs and third is a hormone-releasing IUDs. Non-medicated IUDs they increase the phagocytosis of sperms within the uterus as Lippy's loop. Then copper-releasing IUDs along with the phagocytosis of sperms, the copper ions release suppress sperm motility and fertilizing the capacity of sperms as CUT, CU7, Multilo 375. Then C is the hormone-releasing IUDs. These make the uterus unsuitable for implantation and the cervix hostile to sperms. This is progesterate LNG20. The next is the fourth is oral contraceptives. These involve uptake of the hormonal preparations of either progestins or progesterone, estrogen combinations in the form of pills. Second is they inhibit ovulation and implantation as well as alter the quality of the cervical mucus to prevent entry of sperms. Then Sahelli, an oral contraceptive for females containing a non-steroidal preparation, was developed by scientists at the Central Drug Research Institute CDRI in Lucknow. Pills have high contraceptive value and few side effects. Then injections and implants. Progestrogens or progesterone-estrogen combination can also be used by females as injections or implants under the skin. Then their mode of action is similar to that of pills but their effective periods are longer. Then surgical methods. Sterilization. These are terminal and permanent methods which block the transport of gametes and thereby preventing conception. Here in males, vasectomy is done. A small part of vas deferens is removed and tied up through a small incision of the scrotum. that is vasectomy, while in the females, there is tubectomy is done. A small part of fallopian tube is removed and tied up through a small incision in the abdomen or vagina, that is tubectomy. Then is a medical termination of pregnancy. It is defined as the intentional or voluntary termination of pregnancy before full term. MT means medical termination of pregnancy. It was legalized by Government of India in 1971 under strict conditions to avoid misuse. It is done in these situations. That is, the first is a failure of contraceptive used during coitus or rapes. Then second, when continued pregnancy is harmful or fatal or either mother or fetus or both. Then third, next is it is safe during first trimester, that is up to 12 weeks of pregnancy. Then fifth topic that we are going to discuss is the sexually transmitted diseases. Briefly we can call them as STDs. So infections or diseases that are transmitted through sexual intercourse are collectively called sexually transmitted diseases, STDs. We call them as venereal disease as well, or reproductive tract infections, RTIs. These include gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, HIV. So early symptoms, they include itching, fluid discharge, slight pain and swellings in the genital region. Then complications due to chronic STDs, pelvic inflammatory diseases, abortions, stillbirths, ectopic pregnancies, infertility or even cancer of the reproductive tract. Then transmission of the hepatitis B and HIV occurs by these ways. First is the sharing of the injection needles or surgical instruments with infected person. Then second is the transfusion of infected blood. Third is a transfer from infected mother to the fetus through placenta. So by following the simple principles, STDs can be prevented. First is avoid sex with the unknown partners, multiple partners. Second, always use condom during coitus. Then third, contact a qualified doctor for any doubts in early stage of infection. Now next topic we are going to discuss is the infertility. It is the inability to produce children in spite of unprotected sexual cohabitation. So the reasons of infertility, they could be physical, congenital diseases, drugs, immunological or even psychological. Specialized healthcare units called the infertility clinics, they could help in diagnosis and correction treatment of some of these disorders. Then the infertile couples, they could be assisted to have children through certain special technologies called the assisted reproductive technologies, ART, which are of these types: test tube baby programs, gamete intrafallopian transfer, intracytoplasmic sperm injections, and artificial insemination. Test tube baby programs, they include, in this method, ova from the wife or donor female and the sperms from the husband or donor male are collected and induced to form zygote under simultaneous simulated conditions is in the laboratory, and this process is called in vitro fertilization, briefly IVF. And the zygote, second point is the zygote or the early embryo with up to 8 blastomeres is transferred into the fallopian tube. Process is called zygote intrafallopian transfer, or we may call it as ZIFT, Z-I-F-T. And embryo with more than 8 blastomeres is transferred into uterus. Process is called intrauterine transfer or IUT. Then third point is in a female who cannot conceive, embryos formed by fusion of gametes in other female called in vivo fertilization, they are transformed. Then second point, it includes gamete intrafallopian transfer, that is GIFT, G-I-F-T, GIFT. It is the transfer of an ovum collected from a donor into fallopian tube of another female who cannot produce one but can provide the suitable environment for fertilization and further development of the embryo. Then third point includes intracytoplasmic sperm injection, ICSI. It is a procedure to form an embryo in the laboratory by directly injecting the sperms into the ovum. Then fourth is the artificial insemination, AI. In this method, the semen collected either from the husband or a healthy donor is artificially introduced into the vagina or into the uterus, intrauterine insemination or IUI. So this technique is used in cases where the male is unable to seminate sperms in the female reproductive tract or due to very low sperm count in the ejaculation. So this was all about the reproductive health. Now you are able to tell the questions which are related to this lesson. First question is, what do you mean by reproductive health? Second question is, what is population explosion? Third is, what do you mean by birth control? Fourth question is, what is medical termination of pregnancy? Then fifth question is, what do you mean by sexually transmitted diseases? And sixth question is, what do you mean by infertility? Now the answers of these questions that I would like to tell. First is reproductive health. Reproductive health means a total well-being in all aspects of reproduction, that is the physical, emotional, behavior and social. And second question is, what do you mean by population explosion? Answer is, the tremendous increase in size and growth rate of population is called population explosion. Then third question is, how could you control birth, or what do you mean by birth control? Answer is, the most important step to control population growth is to motivate smaller families by using various contraceptive methods and the methods that we have discussed in detail. Now next question is, what do you mean by medical termination of pregnancy? Answer is, it is defined as intentional or voluntary termination of pregnancy before full term. Then fifth is, what do you mean by sexually transmitted diseases? Answer is, infectious or diseases that are transmitted through sexual intercourse are collectively called sexually transmitted diseases. STDs or venereal diseases, VDs or reproductive tract infections, RTIs. Then next question is, what do you mean by infertility? Infertility, answer is, it is the inability to produce children in spite of unprotected sexual cohabitation. So, I think you have understood the lesson reproductive health. Thank you.
Doaba Radio, Doaba Radio, Doaba Radio, Doaba Radio.
Doaba Radio.